We're moving on to Science and Health. Greg Clark. We're now quite far behind, I'm afraid. You're muted, Greg.
Okay. Is that better?
Yeah.
Good. Prime Minister, good afternoon. It's good to see you back. You get a lot of scientific advice. Do you see it yourself?
I don't, Greg. Thank you. I don't. Good to see you too. I don't actually read the scientific papers except in exceptional circumstances. But what I do get is the direct digest from SAGE, which, as you know, is chaired by Sir Patrick Vallance and co-chaired by Chris Whitty, and they give me the cream of that advice.
Okay, so you get a summary from reading that advice. Can you explain why we have in this country a policy of 2 meters social distancing when the World Health Organization recommends 1 meter, and countries that have a very good track record in controlling COVID, countries like Hong Kong, Singapore, Australia, and Germany, specify either 1 meter or 1.5 meters?
Well, look, Greg, you're making a very important point, and one that I've made myself several times, many times in the course of the debates that we've had.
What was the advice from SAGE?
And the advice from SAGE remains at the moment that there's a very considerable reduction in risk at 2 meters. My own hope, and this is where I hope we can get, my own hope is that as we make progress in getting the virus down, in reducing the incidence, that we will be able to reduce that distance, and which I think will be particularly valuable on transport and clearly in the hospitality sector.
But the virus is international. The virus doesn't recognise international boundaries. Science is international. Have you asked your advisors why our specification should be the highest in the world?
I have actually,
what was the answer?
And their answer is that that's what they feel is the right interval for us to protect. That's why
there's a difference.
And I can't. You know, we rely and have done throughout on the guidance we get from our advisors, and that is what they think is appropriate at the moment. But Greg, you know, that may evolve. As you know, SAGE has changed its advice, for instance, on face coverings.
Advice needs to be interrogated and discussed, Prime Minister. But perhaps you could ask SAGE to review the 2 meter rule in good time for shops and other places to consider their practice on the 15th of June and publish what they say, because this has a massive impact on whether many workplaces can open. Would you make that commitment?
I can not only make that commitment, Greg. I can tell you that I have already done just that. So I hope that we'll make progress.
Promising, good. When contact tracing is underway, if you're phoned up and told to stay at home because you've come into contact with an infected person, is staying at home compulsory, or can people use their judgment?
No, it's we want people to understand that this is something that is really not just good for them, because they'll stop spreading the disease to those they might love and know, but also good for the whole.
Is it compulsory or is it advisory?
We intend to make it absolutely clear to people that they must stay at home. But let me be clear. Matt will be.
What do you mean by must? Is it a law or is it advice?
We will be asking people to stay at home. If they don't follow that advice, what we will be saying is we will consider what sanctions may be necessary, but financial sanctions or fines or whatever. But what,
of course, by the police or by civil authorities?
Well, whatever is appropriate. But what I would say. Monday, whatever I know, because we're not bringing. To begin with, we're asking people to do it as a matter of course. If they're contacted by an NHS tracker tracer, then you should. If you're contacted by an NHS tracer and you're told that you've been for more than 15 minutes less than 2 meters away from somebody who has tested positive for coronavirus, then you should self-isolate. That's what we're saying. And
you should advise.
You should. Now,
Mr. Clark.
if people don't, as I say, we will consider bringing in financial sanctions, fines.
Last question, Mr. Clark.
Let me just ask one wrap-up, if I may, Bernard. Do you have to talk to the contact tracer? Have you got an obligation to do that? And would it not be a good thing to be able to offer anyone that is contacted an immediate test with rapid results, as conforms to international best practice, such as in South Korea, rather than advising them, as it seems, to lock themselves away for 14 days, not knowing whether they've tested positive?
Sorry, let's be clear. Sorry, thank you, Greg. Important point. Clearly, if you are asked to self-isolate and you develop coronavirus symptoms, you will of course have a test. The difficulty.
But what if you don't have symptoms?
The difficulty with testing people who are asymptomatic is that they may very well have the disease but not test positive for it for a long time, and that can run right the way through, I'm afraid, for quite a long period. So that's the difficulty we have there, Greg. Just too many false negatives. Now, a lot of people will listen to this and
so say, scientific advice, not capacity, that is driving that. You've had advice that you shouldn't do that on scientific grounds rather than capacity.
That's completely right. And a lot of people listening to this will say, and this is a big change, right? And so people need to listen to this and understand. They will say, hang on a mo, you're telling me that if somebody from NHS Test and Trace contacts me and says, I'm a contact of somebody who has coronavirus, I've got to self-isolate for 14 days. I'm afraid the answer to that is yes. Clearly, if they have a test and they test, and if they have symptoms and they test positive, then they're out after. Then the self-isolation ends after 7 days. But if I'm afraid if you're asymptomatic, you don't have symptoms, then you've got to do it. Now, people will say this is a grave imposition. And again, to get back to the conversation we've been having throughout this session, it is a huge imposition, but it will be on a very small minority of the population, a very small minority of the population. And I would just say to everybody that it's worth it, because that is the way that other countries, that is the tool that other countries have used to unlock the prison. To make sure that we can go forward. And so that captivity for a tiny minority for a short time will allow us gradually to release 66 million people from the current situation. So I do think it's the right way forward.
Thank
you very much. I think my time's up.
Jeremy Hunt.
Thank you, Prime Minister, and good afternoon. Today's announcement on track and trace could be an absolute game changer, but it's only possible because we have massively ramped up testing. So I'd like to start by asking why it took until April to introduce the 100,000 test target, even though our first confirmed case was in January.
Well, Jeremy, I think, as you know, the difficulty we faced when this virus, we had several difficulties. First of all, this was a totally new virus, and it had some properties that everybody was quite slow to recognize across the world. For instance, it is possible to transmit coronavirus when you are pre-symptomatic, when you don't have symptoms, and I don't think people understood that to begin with.
What was the reason for the delay, Prime Minister?
Our testing operation, as you know, began much earlier. We did have a test, track and trace operation, but unfortunately, we did not have the capacity in Public Health England, to be absolutely blunt. We didn't have the enzymes, we didn't have the test kits, we just didn't have the volume, nor did we have enough experienced trackers ready to mount the kind of operation that they did in some other Eastern Asian countries, for instance. And I think the brutal reality, Jeremy, is that this country did not learn the lessons of SARS or MERS, and we didn't have a test operation ready to go on the scale that we needed. We now have that, and as you'll appreciate, during the peak of the epidemic, when numbers of cases were running very high indeed, test, track and trace would not have been appropriate. It's now the appropriate solution.
Prime Minister, my question was really why we waited from January to April before expanding that capacity. But one of the consequences of that is that we couldn't test everyone who was being discharged from hospitals. Did you get any advice that doing that meant we could risk spreading the virus into care homes?
No, and as you know, a huge effort was made to try to protect care homes, and don't forget that as Chris Hobson of NHS Providers has said, every discharge from the NHS into care homes was made by clinicians who, and in no case was this done when people were suspected of being coronavirus victims. And actually, the number of discharges from the NHS into care homes went down by 40% from January to March. So it's just not true that there was some concerted effort to move people out of NHS beds into care homes. That's just not right.
No, but there is obviously risk if you can't test people when they leave hospital. And countries like Germany insisted that care homes quarantine people arriving from hospital, and we didn't. Now, just on to today's announcement, which is so important. You said you want a world-beating system, and most people think that Korea and Taiwan are amongst the places that have done this best. But in those countries, the test results are returned within 24 hours. With us, it's 48 hours, twice as long. And that means that the people who are contacted because they've been near someone with coronavirus have longer to spread the virus to others. So why don't we get our test results back in 24 hours?
Well, Jeremy, it's a very good question. And actually, we are reducing the time, the delay on getting your test results back. And I really pay tribute to Dido Harding and her team. The UK is now testing more people than any other country in Europe. And she has she's got a staff now of 40,000 people, 7,500 clinicians, 25,000 trackers in all. And they are rapidly trying to accelerate the turnaround time. I will send you the latest figures after this meeting, but we are reducing the delay the whole time. And
I understand that.
48 hours, a chunk of them are already within 24 hours, and that chunk is growing.
I understand that, but I've got 3 care homes just in my constituency that have had to wait more than a week to get their results back. And isn't the truth that actually turnaround time is just as important as the volume of tests? So why don't you as Prime Minister just say, this is a public health emergency, I want all test results back within 24 hours, because that would galvanize the system and make the test and trace system work much more effectively.
Well, we have done that, and that's exactly what Dido.
What you've introduced a 24-hour target.
Yes, absolutely. Okay. And that's her goal. And if you talk to both to Dido and to Chris Whitty, the CMO, the Chief Medical Officer, they would agree strongly with you that the quicker the turnaround time, the faster you can check whether someone actually has a coronavirus, the more effective your test, track and trace operation is going to be.
And when have you told them they have to meet that 24-hour target by?
I'm not going to give you a deadline right now, Jeremy, because I've been forbidden from announcing any more targets and deadlines.
But give me a sense. Is it in the next week, or is it going to be, in the next month? Give me are we talking weeks or months?
It's going to be as soon as possible.
Weeks or months, Prime Minister.
Perhaps I could just say one thing that might be of use to Jeremy and to the committee, which is to understand where we are with test and trace. Tomorrow, and we must be absolutely clear about this, I'm not going to pretend to you, Jeremy, or to the committee, that what we will have tomorrow will be valuable, it will be useful, it will be a very important tool in our fight against coronavirus, but it will be getting steadily better to become a truly world-beating test and trace operation in the course of the next days as we go through June. This has gone from a complete standing start to a huge operation. And so, Jeremy, I don't want to give you a exact deadline for when we'll get down to 24 hours, but that is plainly the ambition, and we'll do it as soon as we can.
Okay, a final brief question, Prime Minister. Like us, Canada, Israel, and Singapore all have a lot of agency workers working in their care homes, and they've banned them from working in more than one care home because they don't want agency workers to spread the virus from care home to care home. Will you look at doing the same thing here?
Not only that, Jeremy, but we've done that already, because what we've said, if you look at our care home action plan, what we said was we were going to stop the movement, the migration of workers from one care home to the next, because plainly that was what was happening. You were seeing outbreak after outbreak because staff were moving from, particularly in chains of care homes, from one to the next. So that has been put a stop to, and that's why the number of outbreaks in care homes has gone down from in the hundreds a few weeks ago to 7 or 8 a day today, and that's why the number of deaths in care homes has now come down so dramatically. I'm not going to pretend that this has been anything other than a tragedy, an absolute tragedy, what has happened in care homes. But the care home action plan, including the measure that you've just described, has already had a very, very powerful impact.
Can I just interject, Prime Minister, that what is causing the delays to tests? How are you resolving those problems, and who's in charge of implementing that resolution?
Okay, the delays to testing are caused very largely by difficulties in the labs with actually producing the results in a speedy and effective way. And we've had problems with some labs I'm not going to mention by name that haven't just, things have fallen over in their operations. They haven't been able to get the results back fast enough, and so we're working on all sorts of solutions, including batch testing and other faster methods of testing that I'm sure the committee are already familiar with, pregnancy style tests and so on, in order to speed it up. So there've been a host of technical problems, but notwithstanding those problems, the UK is now testing capacity is now up at about 100.
That's been very helpful. We'll stop there. That's very helpful.
And we're going to go up to 200.
Clive Betts.
Thank you, Bernard. Prime Minister, good afternoon. You mentioned that this whole system of testing, tracking and tracing was from a standing start. But already in this country at the beginning, we have a lot of highly qualified professionals called directors of public health, who are experts in the field of contacting people, tracking and tracing. Why were so many of them last week saying that their involvement in designing this system had been minimal?
Well, Clive, that's one of the issues that I've raised repeatedly, and has been raised repeatedly with me, a strong desire to have much more local expertise and use all the local knowledge far more effectively. And one of the reasons why we decided at the heart of Dido's operation is the chief executive of Leeds Council. I'm sure you know who is helping to make sure that we're not trying to reinvent the wheel here. We are using local experts, people who understand their communities, as well as recruiting more trackers from around the country.
Well, I say it seems to many people that the involvement locally was almost an afterthought. So we're now going to have this grand national system. The Department of Health's involved, the Public Health England are involved. We've got phone banks, we've got an app eventually. How will the local arrangements that you just described, the involvement of Director of Public Health, fit into that? And who in the end will be accountable for the whole system?
Well, I will be accountable for everything, but the person.
So we can blame you for everything that goes wrong, then, Prime Minister.
In my experience, it's very hard to avoid blame, and quite right too. But look, Dido is leading it, and she's doing a very good job. And I thank her and her team. They got a standing start, 40,000 people.
Well, let's go on a little bit, because I think the government have now announced that there will be, every area will have an outbreak control plan, an outbreak control committee who will be responsible for that plan. Precisely, who are these committees? Who's going to form them? And if there are going to be local lockdown measures, which have been referred to recently, will it be the local committees that decide on those and impose them?
Thanks very much, Clive. No, what we will be, obviously we'll be working with the local outbreak committees, and those responsible for dealing with whatever happens locally will clearly go through the local resilience forums, which are leading on this. But there will be strong directional effort and control from the joint biosecurity centre that we are now setting up. And members of the committee will be familiar with this change. We're moving to we're going to have much more observation and detailed knowledge of what's happening.
So those local committees are responsible to the Biodiversity Committee at national level.
That's it.
That's how it works.
That's it. And the Joint Biodiversity Biosecurity Centre will be looking at, for instance, the other day you saw there was an outbreak in Weston-super-Mare, and we moved very quickly to close things down there to try to sort it out. That's the kind of whack-a-mole tactics that we're going to use as we keep driving the virus down and keep reducing the incidence. It's very, very important that we have a very sensitive test, track and trace operation in order to cope with local outbreaks.
Right, can I just follow? It refers to a question that Greg Clark asked earlier. I understand there probably are long-standing sanctions for people who don't isolate with a disease which is notifiable under the public health rules. Directors of Public Health seem to understand that. But what is missing, Prime Minister, is that if someone is infected and then is asked for information about the people they've been in contact with, I understand there are absolutely no sanctions if they refuse to provide that information. Isn't that a major hole in the system that needs addressing?
Prime Minister.
Thanks, Bernard and Clive. Yes, you're totally right that this is something that we're relying on people's public spiritedness, on their willingness to cooperate and defeat the disease. And I have to say that in other areas of very delicate, very sensitive areas where people do need to give details of their contacts, such as HIV transmission, it does work. So, Clive, I am confident that it will work in this case.
But if it doesn't work, will you look at sanctions then? Because this is maybe something that we need to do. Well,
obviously, we're relying very much on the common sense of the public to recognise the extreme seriousness of this. This is our way out. This is our way of defeating the virus, getting our country back on its feet. And I think people will want to work together.
I think most people will, Prime Minister. It's those that won't that we have to deal with, surely.
Correct. Clive, you're correct. And that's why I said what I said earlier on, I think, to Greg, that we would, of course, we would keep sanctions on the table. And as we develop the system, we will review constantly what kind of cooperation compliance we're getting.
Thanks.
Thank you, Bernard.
Point well made, Clive. Thank you. Prime Minister, can you just explain who Dido is? Who is she? What is her role? Just for the public to understand.
Dido Harding is a senior executive in the NHS who's crossed over to work full time now on bringing together across departmentally and across all the institutions involved, whether Public Health England or the care homes or whoever it happens to be, the test and trace operation. So she is responsible for NHS test and trace. And that's what's being launched this evening by Matt, and that's what goes live tomorrow.
Very good.